Assalamualaikum and a bit to all. My name is Assman Hazim and today I would like to discuss on the issue of drug clearance in children. To be specific, we choose midazolam, which is a drug, as our matter of concern. Cases such as overdose of drug in children oftenly happen and majority of it leads to fatality. Such cases could be prevented and avoided if we give full concern on how to calculate the drug clearance in children. So guys, before we go any further on how to calculate the drug clearance in children, I would like to define what is midazolam. Midazolam is a drug given by the doctor to their patients before undergoing surgery. The function of midazolam is to give drowsiness or to reduce anxiety of the patient before undergoing their surgery. So now, let's go to the part where we calculate the drug dosage. Briefly, there are two clinical practices that have been used in determining drug dosage. First is the Clark's rule and the second one is the Young's rule. Clark's rule stated that we determine drug dosage depending on the weight of the children, whereas Young's rule stated that we determine the drug dosage depending on their age. However, both of the methods are not valid because of the physiological factor of the patient itself. Now, the best method of calculating or estimating drug dosage are by calculating the drug clearance in patient by using allometric scaling method. This is the best way to calculate or estimating the drug clearance. To know further about this, my friend will continue.
Hi everyone, my name is Azziem Azzhan. Consider I am a doctor and this is 5 years old patient that will be given midazolam because he is going to surgery after this. How many milliliters should I give to him? Is 2 milliliter correct? How do I know? The amount of drug that I should give is based on drug clearance formula. So, this is the formula on how to calculate the drug clearance. P child equal to P adults times WT over 70 power of B. P is the parameter of interest, so now we are going to calculate the parameter of child based on the parameter of adults. WT is the body weight of the individual child, while B is the allometric exponent. Based on this formula, P, the parameter of interest, and B, allometric exponent, are the constants. Okay, some of the book consider 0.75 is the pure allometric exponent, but some have issue with it. So now, it is our concern to determine if the exponent 0.75 is the most suitable exponent for the prediction of midazolam clearance in children from the adult data. After that, to study for the exponents that might be more accurate or as good as 0.75. So we expand the exponent from 0.75, 0.8, 0.85 and 1.0. And lastly, to emphasize the sensitivity of drug dosage for infants and neonates.
Now we are going to put our data on this function. We are going to calculate the prediction of midazolam drug clearance using 4 different exponents, which are 0.75, 0.8, 0.85 and 1.0. This calculation is for the infant of age 1 to 7 days, the premature. It means the infants that was delivered under the optimal period of gestation. So that's how we obtain our result. Now we are going to see the overall result. The result is shown in this table. From the table, we can see that there is a column called the observed clearance. Observed clearance is the clinical data for the midazolam drug clearance. Now we have both the clinical data and the prediction data. We can calculate the percentage error of prediction of midazolam drug clearance by different group age. The equation of the percentage error is the observed data minus the predicted data times 100 over the observed data. And the overall result is shown in the table followed.
The result of prediction clearance in the age group of child less than 1 year are not reliable compared to observed clearance, as the percentage error is more than 100%. But for 5 years old children show the precise predictions of clearance by 0.75 exponent with the observed clearance. It means that 5 years old children could have same metabolism rate as the adults. And then, allometric exponent 0.85 is suitable for children in range 34 until 41 weeks, even with a small difference of weight. This is because psychological events in neonates and infants occurs very rapid and change the pharmacokinetic development child. From this, we can conclude that 0.75 is not the most preferred allometric exponent in infant but can be used for 5 years old infant. 0.85 is suitable for gestational phase children. And lastly, drug dosage of midazolam should be prescribed by specialized clinical technique as it is sensitive to infant.
Assalamualaikum warahmatullahi wabarakatuh. Kau pegang?